Today, we all are gathering virtually to attend the webinar on early integration on palliative care. So, first of all, I introduce about myself. My name is Suren Singh Gujjar. I am working as assistant professor in Parul Institute of Nursing, Parul University, Vadodara, Gujarat. Now, let me introduce about our guest speaker and their biography. The name of our guest speaker is Mr. Walk Lady Bobby, MSc Nursing in Medical Surgical and specialty in critical care and emergency nursing. He also pursued PhD nursing from Bharati Vidyapeeth Pune in the specialty of palliative care. Professional profile: Mr. Wagledi Sir is enthusiast, success-driven educator with proven unconditional commitment to teaching and expertise in developing intuitive connection with the students, identifying and working on their learning needs, utilizing differentiate instruction methods, and creating motivational techniques that create inspiration and encouragement. Sir has completed his graduation in 2013 from Bharati Vidyapeeth and completed post-graduation in medical surgical nursing in 2016 from Bharati Vidyapeeth Pune. He is also pursuing his PhD from Bharati Vidyapeeth Pune. He also certified in various programs such as leadership development and training programs in 2011, food reflexology in 2014, and end-of-life nursing countries. Sir has also worked as a staff nurse in Bharti Hospital and Research Center, Pune from 2013 to 2014, clinical instructor in Bharti Vidyapeeth College of Nursing from 2016 to 2021, and currently Sir is working as head of department in palliative training and awareness, Silpa Palliative Care and Training Center, Pune from 1st March 2021. In additional professional activities, Sir also worked as a community health nurse serving as special rural healthcare assignments and pulse polio vaccination on nationwide programs for child healthcare. Sir also attended more than 20 national and international conferences, seminars, workshops as a delegate as well as resource person. If we are talking about the achievement of Sir, Sir also got first prize, second prize many times during the college week, Bharati Vidyapeeth College of Nursing Pune. Proficiency first prize, Sir also got first prize in group song, in photography, in MEDEC during the session of 2012 to 13. Sir also get Best Bedside Nurse prize in BSc Nursing during the academic year of 2009 to 2013 and proficiency as Vice President of SNA during academic year 2012 to 2013. If we are talking about the publication and strength of Sir, Sir also have conducted various researches and have many publications in international journals and have strength in various aspects such as comprehensive medical and nursing knowledge, communication, negotiation, facilitation, problem solving methods, decision making, program management, flexibility, presentations. Sir have many membership in professional bodies like lifetime membership in Maharashtra Nursing Council, lifetime member of TNAI, lifetime membership of National Research Society of India, and lifetime membership in Parivartan Alumni Association. So, sir, I welcome you on behalf of Parul Institute of Nursing. Now, without further delay, I request to you, sir, please start the session.
Thank you so much, Surendra sir. At the outset, I would like to thank respected principal of Parul Institute of Nursing and the team and the management, especially Swapnil, for coordinating this call. And to begin with, I would also like to thank CIPLA Palliative Care and Training Center head and my colleagues for really assigning this task to me so that I could present the best to our viewers and participants. So today I will be speaking on palliative care. If you just give me a second. If you can confirm, if you can see the screen.
Yes, sir.
Okay. So today we will be speaking on palliative care and most importantly about early integration of palliative care. Now this concept would be new for many, and I think this is the right time to speak about it, especially because we are in the World Hospice and Palliative Care Week, and tomorrow, that is 9th of October, is World Hospice and Palliative Care Day. And the theme is equity in access to palliative care for everyone. That is where the role and the importance of palliative care as a nurse really comes into play. So to begin with, what is palliative care? Many of us would not know it, or some would do know it, would think that it is something that has to do with cancer, or something that has to do with end of life, something that has to do with something for a patient that is not really surviving. So palliative care, it comes from a Latin word which is called as palliare, and it means to cloak. The meaning of cloak is to surround yourselves completely in a 360-degree format. Completely surrounding and clothing is called as palliative care. So it is an active total care of patients which is focused on improving the quality of life of patients that are having life-limiting conditions. So it's an active care that is looking after the patients in a complete and all-around manner that is going to improve the quality of life of patients, and also it is going to help the patients cope during these illnesses. So as per WHO, it is defined that palliative care is an approach. Many of us, especially in nursing, we have seen that our definition starts with the science. Nursing is a science, or you can say any other field, medical field. It says that it starts with the science, but whereas palliative care, it's not a science, it's an approach. And that approach is that it improves the quality of life. It is proved that palliative care is improving the quality of life of patients. And this is not just the patients, but also their families that are facing the problem with the life-threatening illness. So if there is a patient that is having a life-threatening or life-limiting condition, it is going to affect the family as well. But palliative care is going to improve that. And it is going to improve through few means, that is through prevention and relief of suffering. So it is very necessary for us to identify the patient early so that we can prevent them having any sufferings, and also provide any sufferings by means of early identification. Yes, as per the WHO definition, it very clearly says that we have to identify that the patient needs palliative care early by impeccable assessment, by completely thorough assessment that we need to do, and treatment of pain and other problems that are physical, psychosocial, and spiritual. Very necessary that in palliative care we have treatment of pain and other problems which could be physical, psychosocial, and spiritual. We will get to understand this definition and about palliative care in the coming slides. So palliative care is all about making a difference by offering and enabling patients to make their choices. So in palliative care, we allow the patients to make choices, and also the family to choose what should be their role in the disease trajectory. Palliative care improves in quality of life as well as possible for as long as possible. So there is no limit to receiving palliative care. As long as possible, the patient can receive palliative care for the improvement of quality of life in the best possible way. Also, supporting adjustment and goal setting. It is necessary that we need to identify where the patient requires palliative care, and based on that, we need to identify the goals that need to be fulfilled. Improving the experience of death. It is a very painful situation, but yes, we need to improve the experience of death for the patients so that the patient does not have a painful or a very tragic form of death. The patient should have a very comfortable death. And also improving the bereavement outcomes, which means that after the patient has passed away, the family needs a lot of attention and a lot of care and understanding. Based on that, we need to look after the family as well till they come out of their grief. So what can be done in palliative care? Good clinical care to begin with. That is very much necessary to ensure that the patient is symptom-free. Facilitate the patient's and the family's choices. Many of the patients, they wish to receive palliative care at their home. So we need to understand that and we need to provide that for that patient. good psychological support. That is very much necessary, because any life limiting condition, it surely has an impact on the psychological aspects. Advanced care planning on end of life care. So that is very necessary, because when we know that there is a patient who is not going to survive for too long, we need to plan much in advance, and we need to ensure that we are fulfilling the wishes of the patients as well. Bereavement support is very much necessary. That is, after the patient has passed away, we have to look after the family and support the family in all ways possible. There are certain myths about palliative care. I'm sure many of you would have too. First myth is that patient must be at end of life to receive palliative care, which is absolutely wrong. Palliative care is to be provided for patients at the start of their disease, at the diagnosis of the disease. That is where the patient needs the most care and the most attention. That's why patient needs support throughout the condition, and it has to be initiated at the very early stage, that is at their diagnosis. The other myth is that patients cannot be provided alongside with curative treatment. Palliative care can be provided alongside curative treatment. For example, if there is a patient who is receiving chemotherapy, alongside the chemotherapy, the patient's symptoms to be managed, such as nausea, vomiting, and the diet, and all the other complications that are associated with chemotherapy, are completely managed using palliative care. So it can be given side by side, complementary to the curative therapy. There's another myth that patient will lose hope if they are referred for palliative care. This is something that we need to change. Palliative care is going to improve the quality of life. So it is not going to help. It is not going to cause loss of hope for patient. It is in fact going to give them more will to survive, and it is going to help them in their symptoms. It is going to help them cope with the disease condition. And definitely palliative care is not just for the patients who are going to succumb to death, but also to those who are having chances of survival. So palliative care in total provides relief from pain and other distressing symptoms. It affirms the life and regards dying as a normal process. It neither hastens nor postpones death. It integrates the psychosocial, psychological, and spiritual aspects of the patient. It offers a support system to help the family live as actively as possible until death for all ages. And it also offers a support system to help the family cope with the disease of their patient in their own bereavement stages. To do that, we have to ensure that there should be good goals of care. And goals of care are based on the evidence that we have. Evidence-based goals, good clinical care is already present. If you look at research, you will find many of the articles that are proving that quality of life has been increased. There is good patient satisfaction, and the family also is well versed with the kind of care that the patient receives. Also, that achieving best quality of life for patient and their family is required, and that should be the ultimate aim of our palliative care. In the evidence-based good clinical care, we have to look for the best possible curative treatment options. So when the treatment is ongoing or at an early stage, when the cancer or any life-limiting condition is diagnosed, we have to look for the best possible curative options to ensure that we are treating the patient at the right time. Supporting the patient with supportive care for treatment-related side effects is very much necessary, and that is very well managed with pain management and other symptoms in palliative care. The patient's information's need that has to be addressed is the information about the disease. Many a times the patient do not know what they're having, whether it's a cancer, whether it's a tumor, whether it's metastatic. They do not know these terms. It is very important as a palliative care nurse, or any nurse for that matter, to ensure that the patient gets all the information that they require. Especially symptoms should be well managed. Many a times, due to radiation, due to chemotherapy, there are several symptoms that the patient will be undergoing. And that has to be managed very, very precisely so that the patient does not lose hope in the treatment. Being in control, yes, it is necessary that the patient has to be in control, because that is the way the patient will be compliant to the treatment and will be continuing the treatment as long as possible. We need to develop a care plan for the patient, which will be necessary in ensuring that everything is delivered to the patient based on the requirement and the assessments that we do. And the continuity of care also is to be ensured, following which the patient, if is not going to be in a curative phase, should be ensured that care will not be compromised till the end. The most important aspect in palliative care is holistic care. So holistic care basically is the spiritual, physical, psychological and social aspects of care. In palliative care, we look at all of these elements in caring for the patient. Of course, physically, because the patient is undergoing a lot of physical symptoms. Psychologically, yes, the patient is undergoing depression and stress. We need to address that. Socially, due to disfigurement or due to several hospitalization, the patient will not be having an active social life. And spiritually is when the patient starts to question himself as to why this has happened to him and what was the reason why only he is going through this suffering. So we have to look at the patient as a whole, and we need to address the situation in a holistic way and ensure that the patient is receiving the complete care. For this, we require a multidisciplinary team, and palliative care is not a one-man job. It requires a big team, and the team consists of a pain physician, the nursing team, the medical social worker, the counselor, dietitian, physician. These are the palliative and supportive care team. And it is all because of a palliative and supportive care physician who is going to lead this team in ensuring that the patient gets a complete holistic care. So the main question that always arises is, when should palliative care be initiated? Since we are talking about early integration of palliative care, it should be initiated at the diagnosis, or should it be initiated maybe after some time of the treatment when curative treatment is going on and we are maybe not getting success through it, or maybe at the end where nothing has really helped. So basically there is no right or wrong answer. But what is important is we have to think about it. So very important is ongoing treatment and palliative care is not contradictory. So you need to know that palliative care should begin early, but there is no right and wrong answer when it should actually begin. But for this, we have a very evident reason to start palliative care early. We follow an ideal model. So this is a model which is developed by Sir Robert Roycross, which is stating that when the patient is diagnosed, we have to initially begin with supportive care. And that is where the disease-modifying therapies such as radiation, chemotherapy, or surgery, or any other form of treatment is at the active. And we start out with supportive care and slowly improve our services up to a point when the disease-modifying therapy may not work and has to be stopped. At that time, the patient is completely taken on the palliative care treatment, and the patient is completely given the requirement for the patient's goal and advanced care planning. Finally, at the time of death, the patient is discontinued of palliative care, and the patient's family is then taken on bereavement support, which will be tapered off as the patient's family comes back to normalcy. So there are some advantages of this model. First is that the primary oncologist is in charge and kept in the loop, so that the oncologist knows what the patient is going through and is not having that stress, or that the patient may leave the treatment at some time, may discontinue the medications, or even may undergo a lot of other symptoms during the treatment. In the beginning, the palliative care team will have a supportive role only to ensure that limited access for the patient is provided for giving supportive related treatment such as symptom management or counseling or diversional therapy. As the disease progresses, definitely the role also will increase of the palliative care team. This will help in gaining the patient's confidence over a period of time. And it is also easier for the relatives to slowly cope with the situation. So as the situation worsens, the relatives would gain trust and the patient would gain trust on us and would also like to take further services from us. Also, they would be included with complementary therapies like occupational therapy, stoma care, and that will enhance the patient satisfaction. So basically, early integration is what? It is not end of life care only. Neither is it passive care only. It is not a care that is given when all is over, or it is not the loss of hope. Whereas palliative care in an early phase is actually going to manage the pain and other symptoms. It is going to support the patient and make the patient more compliant and more adjourned to the ongoing treatment. Patient would also receive complete psychological support, which is necessary with the ongoing treatment. Patient would also be addressed with the needs of the family members. So it's not just the patient that is looked after, but also is the family member who is looked after. It will be easy for us to manage the difficult conversation in which we tell the patient that the treatment may be working or may not be working while they are in the palliative care treatment. Also, it will help in mobilizing the resources, which is necessary because the patient and the relatives and the family members are already under a lot of stress of paying the hospital bills, are undergoing the curative treatment. So it will be very important for us to provide such resources for them that will help them in their journey. So that is about palliative care and early integration. Now I would like to switch to what CIPLA Palliative Care and Training Center is and what do we do at our center. So CIPLA Palliative Care and Training Center is a flagship initiative of CIPLA Foundation. It was started in the year 1997 and has been providing free of cost palliative care treatment in Pune city and has reached over 18,500 patients since inception. So how do we do it? We do it in three formats. One is home care, inpatient care, and OPD care. Like I said, to ensure that holistic care is to be provided, we need to work as a team. And our team is a multidisciplinary team, which includes a physician, a pain specialist, medical social worker, nutritionist, physiotherapist, a center support team, volunteers, and the nursing team. These teams work in unison and look after the patient's requirements. It is also necessary that we ensure that the patient receives care at their preferred choice of setting. It could be home care, it could be inpatient clinic, or as well as in the OPD, wherever palliative care is available. We believe in the approach for palliative care to be responsive care, because it is the customized care that is required for each patient. Each patient has different needs, each family has different needs. That is why it is necessary that palliative care has to be a responsive form of care for each and every patient. We have a few guiding principles, especially engaging patients and their families in the care that they receive. The more that we talk to the patient, the more that we know about the patient. It is not just that when the patient is coming to us, we only look at the patient, or we only look after their basic needs, but also to know more that they have. For example, if there is a patient, we ask them about their birthdays, we ask them about their most favorite place that they have traveled to, and we ask them of these basic, these minute things that have really touched them, and they share these with us, and we have this bond that is created. We also empower caregivers by giving them the confidence and necessary skills to care for the family members. Many of the patients over here are either bedridden, or they have bed sore, or they have rice tube feeding. So they are not sure of how to care for them. So at our center, we provide training for the caregivers to ensure that they learn how to care for their patient, so that when the patient is going back home, discharged back home, the family members are skilled enough to look after their patient in these basic needs. By applying the multidisciplinary approach, we are able to deliver the holistic care. Like I said, it is not just physical care that is required for these patients, but also the psychological, the spiritual, and the social domains which are need to be addressed for these patients. We also enable patients to have access to palliative care at any point in their disease trajectory and in their preferred setting. Like I said, palliative care is not limited only to the hospital, but it is outside the hospital as well, in their patient's home, in the external OPDs, or in the community where palliative care can be provided easily. We follow a unique model of family care. So in a family care model, a family member stays with the patient at our center and is looked after the patient equally. That is the care that is required for not just for the patient but also for the family members. That care is also provided to them because the family member is stressed out, he's burnt out, he or she is undergoing an immense stress of the family, if of the patient not knowing what the future holds. They need to be engaged in a way where their psychological assessments are done. We have to ensure that they are rest, they're having equal enough rest, and that they are able to, when they are happy, then their patient, when they look at them, they also feel very happy that the relatives are doing well, even though they are in this crisis. And very much necessary in the family care model is that we prepare the family in such a way that they know that when the end comes, they know that they would require the bereavement counseling and they have to cope with the situation in a better way. So our holistic care approach belongs to the doctors, nurse, pain specialist, medical social worker, nutritionist, physiotherapist, center team, and volunteers. It is very necessary for every one of us to come together to ensure that the patient's needs are completely met in a very elaborate way. Also, very importantly, we need to know that it is not just the care, but also these moments of joy and these moments of happiness is what we need to create. As you can see in this picture, there is an elderly couple, and the patient is bedridden. She cannot move. But what she has found is through her partner, she was able to create a moment of joy and that was possible when we initiated an art and craft session for the caregivers. And this is where the sir has prepared a painting or a drawing for his wife, and he has presented it to her. And these are the moments that we really live for. And though the condition may be deteriorating, or maybe the patient would be going through a lot of physical or psychological stress, but if you could see the picture of them smiling, definitely it takes away everything in a flash. We do not limit ourselves to palliative care at the center, but also at the home. 45-kilometer radius of Pune city, palliative care is provided free of cost at the patient's home, ensuring that there is no break in the kind of care that is required for the patient. Especially due to COVID, there was not once that palliative care was not provided at home, and the patient required or received adequate management of pain and adequate management of their condition at their comfort of home. Not just the care, but also training. Palliative care training is very much necessary, and we have to ensure that the training reaches out to everyone. So we provide training, free of cost training for doctors, nurses, medical social workers, and volunteers. Majority of our trainings are TOT based trainings, in which after training you would become a trainer and you would be able to deliver the same training at your organization or at an area or a community that you know of. So training modules are globally evidence-based, and it is based on the curriculum which is adapted to the Indian context. More about training, we have specialized training in which the early integration is included, including in oncology palliative care. And since all the professionals are, we intend to have a lot of palliative care professionals, we ensure that various treatment options and protocols, side effects, trajectories, and prognostications are included in this, so that the workers who are inclined with the oncology are aware of the various changes in curriculum and are also updated with their knowledge. And we have also jointly undertaken various oncologists and palliative care professionals into our trainings to ensure that we complete the entire picture of oncologic care that is required for patients. Few of the trainings that we undertake is Impact, which is integrated module of palliative care in cancer treatment, which is a 5-hour course divided in 2.5 hours per day. It's free of cost course, and it is in conjunction with the SAC Federation of Oncologists, which is for nurses, for doctors, anybody who is in the vicinity of caring for a patient with cancer or wants to know or learn what are the care that is required for caring for a patient with cancer, oncology specifically, and also how do you initiate palliative care. The other trainings that we have is ECHO trainings, which is customized as per requirement of the institution or organization. We also provide training for nurses, which is end of life nursing education consortium, which is a TUT-based training, as well as foundation course training for practicing nurses on palliative care. The other trainings are Indo-American cancer training and end of life for pediatric patients. Training is also provided for nurses and doctors. In our journey, we ensure that we like to walk along with like-minded oncologists to help in relieving the suffering of the patients. Integration is based on referral basis. So if you know any patient who requires palliative care, please do refer at the earliest to ensure that the patient is living symptom-free and receiving complete care at all times. An extra layer of support is always good in any form of treatment, which is why palliative care comes forth. And ensuring that smooth transitioning takes place from curative to palliative care in certain conditions where the disease-modifying therapy has not worked. That is what we look for. So in better outcomes, it may not be produced or pronounced in the terms of survival, but it is in the form of patient satisfaction, the symptom control. There are lesser visits to the hospital and lesser even admissions to the emergency room, with better advanced care planning, reducing the health-related costs, and also better end-of-life outcomes. This is what we aim for. By working together, learning about palliative care and supportive care, by training various professionals, also by creating this interdisciplinary team, which will include all palliative care trained professionals, such as nurses, doctors, and medical social workers, and joint research in some way, which will help to improve this integrated approach that we have, and it is eventually going to lead in excellence in cancer care. We always are open for any form of collaboration in that way. So yesterday, which was 7th of October, we have launched a palliative care helpline, and the number is 1800-202-7777, which is Sat Sat. It's a unique palliative and one of a kind palliative care helpline number, which is active right now, and it is available in a national front. So any person living in any part of India can call on this number if you want to have access to palliative care or have any other requirements in relation to palliative care, in form of care, home care, in form of counseling. Anything that is required in relation to palliative care is available on this number. So I would urge all our listeners and participants to please spread out the word about this number so that it reaches out to the patients that are in need, and they can call on this number and avail the services anywhere in India. For patients who are in Pune, we do require them to contact us. So the WhatsApp number is provided, and in email and inquiry numbers are here. The documents that are required is a confirmed report of cancer, that is a histopath or biopsy, a discharge summary that is mentioning cancer diagnosis, or a referral letter coming from an oncologist that is confirming the cancer diagnosis is all that is required, and everything in the category of care for the patient is free of cost, both for the patient and the families. At Cipla Palliative Care and Training Center, Pune. So if you know any patient who requires palliative care in Pune city, please do refer these patients or give them this information so that it can be it can reach out to them and we can be able to help them when they require us. So with that, I would like to thank each and every one of you for patiently listening and helping me share my thoughts with you. With this, you can also contact us on training.education@ciplacare.com if you're interested in any training related information, or you want to plan a training at our center. Or you can also contact me on my email ID larry.wag@ciplacare.com for any information that you require on palliative care. With this, I would like to thank Parul University, the team, for giving me this opportunity to speak with you. Thank you. Should there be any questions, please do share.
Thank you, sir. Actually, from the audience, I have some questions in my mind, so I would like to discuss with you. First
Yes.
is that how can we use the evidence-based practice in palliative care? Can you explain?
Yes. So if you would have seen that palliative care is a supportive care. We are not providing any curative form of action. We are only providing supportive form of action. And in various of the studies that you see, evidence-based studies, that when you provide any comfort devices for a patient, definitely the patient will feel comfortable. If you provide any psychological care for that patient, definitely the patient's stress and depression is reduced. We have several studies to prove that. And that is the way where palliative care is approached and it is being given to patients. And that is how evidence-based practice is helpful in relieving or alleviating the problems from the patients.
One more thing, sir.
Yes.
How can we identify the need of palliative care to a patient?
Yes, thank you so much. That's a very nice question. It is very simple. When a patient comes to you, and the patient may say that he's in pain, or if the patient would say that he's in suffering, or you may identify that in